The State Department of Health has been releasing all kinds of COVID-related data since the start of the pandemic, including daily positive case counts.
Doctors in our area are weighing in on the daily data, and Newswatch 16's Carmela Mataloni shows us the numbers we should be watching.
Positive COVID-19 daily case counts are high. The latest variant, mixed with post-holiday travel, created another winter surge with numbers in the thousands. These daily figures don't count at-home positive tests. Those results are not required to be reported to the state.
When we talk about overall cases that are within a particular area, we know that that is an underestimate. And the reason for that is that it is certainly reported if you get a positive test that's done through a laboratory. But most people these days are either not being tested because their symptoms are so mild that they are not bothering, or they're doing home testing.
So why continue to keep daily counts if all the positives aren't there? A spokesperson from the State Department of Health says, quote, COVID-19 case counts are still an important measure when you look at data over time, like the 7-day trends we produce in weekly data updates. While keeping tabs of positive cases is important, doctors say a number to keep an eye on is COVID-related hospitalizations. For the first time, the Department of Health did acknowledge that not all COVID patients are in hospitals because of COVID. Some are going to the hospital for other reasons and then testing positive, but the state did not provide full data on that. Some states, like Massachusetts, have moved to reporting that data daily. While not required by the state of Pennsylvania, St. Luke's started to keep tabs back in December when Omicron took hold.
About a third, if not less than that, are associated with COVID, but it's not their primary diagnosis. And obviously, we're still working through some of December's statistics to get a more exact figure.
The Department of Health says any COVID positive patient still puts a strain on hospitals because staff then have to treat the person with extra PPE and COVID care guidelines. Kendra Auker is the CEO of Evangelical Community Hospital in Lewisburg.
I think, it's a mixed bag. I think it gives you an accurate sense of the severity of illness. But whether you're a COVID patient who's severely ill or whether you're a COVID patient getting your ankle repaired, my staff has to treat you like a COVID patient. You're contagious.
Both the State Department of Health and doctors say the best way to keep yourself out of the hospital is to get vaccinated and boosted. Carmela Mataloni, Newswatch 16.